Hello, and welcome to ARAC's GFN Five, titled Advocating Tobacco Harm Reduction, the Role of Nurses in Health Communication. And I am here with ARAC's clinical research team members, Liz DeMartini and Amanda Cox. Thank you so much for joining me here today. I'd like to first jump in to a question for both of you. So as clinical research nurses, what have you come to understand about smoking cessation that you really didn't expect at first when you entered into this space?
Yeah,
Liz.
I've discovered something that's been really an invaluable lesson is that the journey of smoking cessation is that it's not a one size fits all endeavor. So each person's path to quitting smoking, it's unique, and we have to approach that with really careful understanding. There's a lack of education reaching smokers about reduced risk products, and interacting with hundreds, probably thousands of participants, I've heard countless times that they regret not knowing about these products sooner. So I think that we have a really big responsibility to better reach those in need and provide education on what options are available to them.
Well, I've learned that smoking cessation is not linear. It's layered, it's behavioral, emotional, and sometimes even generational. What's really surprised me is how much people want to quit, but they don't feel like they can. Not because they don't care, but because they haven't had someone meet them with the right tools and the right message. I've also seen how powerful small wins can be. Someone goes from a pack a day to 5 cigarettes, and they're proud, and they should be. That momentum matters. It builds trust, and trust builds change. Honestly, I've learned that nurses are in a perfect position to have these conversations because we already know how to speak human and we translate complex medical information all the time. Tobacco harm reduction is no different. It just needs the same clarity, compassion, and follow through that we already bring to every other aspect of care.
Yes, and you both do that beautifully well. So, another question to you, Liz. What would you say is the top thing that people who smoke need? They need to hear in order to successfully quit and to stay successfully off of combustible cigarettes.
Yeah, so these people who are trying to change their lives by quitting, they need education and they need support. I found that in my position at ARAC, I've noticed the lack of holistic care, primarily driven by the lack of education that nurses receive in their education programs, which has transferred into smoking cessation programs. What's lacking right now in the United States and likely across the world is seeing people who smoke as individuals who have unique experiences, values, and needs, just like everyone else in the world. And not only are these people dealing with an addiction, but also the stigma that goes along with it. I think the main thing here is the lack of education on the misinformation surrounding these reduced risk products. We hear repeatedly from participants at these sites that nicotine pouches can cause oral cancer or that vaping is worse than smoking. These are real reasons that the participants have not tried these products before. I think that support from healthcare providers is crucial to the success of smoking cessation, right? The healthcare providers are who these people trust. Working at the bedside for so many years, I heard many conversations take place between physicians and patients. And unfortunately, they were all very alarmingly similar. So the physician would say, you need to stop smoking, period. There was no guidance, there was no support, no alternatives. The physicians are often quick to leave the room with good reason, and leaving the patients with the nurse. I think that creates a really big opportunity. The nurses are the ones with the patients. They're establishing those relationships. The unfortunate thing is that the nurses are also missing this opportunity to provide education because they're also not receiving the education in tobacco harm reduction.
Yes, yes, that's very true, and it is a very sad thing. I think the key takeaway here is that we need to correct the misinformation and the misperceptions that are out there, and that means education. That means educating the people who are smoking, and that means educating the healthcare providers who are most connected with those individuals. So thank you, both of you, so much for your time today. And what they both want to leave you all at GFN is a little bit of positivity and reflection. Thank you all very much for listening and enjoy the conference and take care.